For the patient, this is a guide to improve your perioperative experience, from making the pre-anesthetic appointment up until the anesthetic discharge. It is important to read and comprehend this information, so everything runs smoothly. What is anesthesia? It is a medical field that makes sure the patient doesn't feel pain or discomfort during a surgery or an exam. It will provide the surgeon with the best conditions to perform the surgery, and the patient the comfort of a painless procedure. Who is the anesthesiologist? The anesthesiologists are the doctors with specialized training in anesthesiology, who have qualification to perform the anesthesia. They are responsible for the patient's safety during the whole procedure. They will decide, after clinical evaluation and shared information with the patient and their attending physician, which anesthetic technique will be performed the procedure. What is pre-anesthetic evaluation? Consists in evaluating the patient to obtain necessary information to trace a better plan for the anesthesia. This consultation is usually made in a consultation room, and will be divided in 2 steps, a consultation with the nurse and another with the anesthesiologist. At the end, an anesthetic orientation manual and a hospitalization guide will be given with all the appointments information. In emergencies or urgencies, this evaluation will be performed with urgency, at the patient's bed. In diagnostic outpatient procedures, this evaluation is made moments before the procedure, where the exam will occur. When will the pre-anesthetic appointment be scheduled? It will happen after confirmation on the surgery date. The patient will be directed, via phone, to the anesthesia sector to schedule the pre-anesthetic appointment. After this scheduling, the patient will receive an SMS or email to confirm the appointment, and instructions related to the appointment. Consultation with the nurse. This is the moment for the nurse to get to know more about your health history. During this appointment, your vital signals, blood pressure, and heart rate, and anthropometric data, weight and height. Orientations about fasting, wearing accessories, prosthesis, and specific preoperative prepare will be reinforced according to the procedure. Consultation with the anesthesiologist. In this appointment, the patient will inform about allergies, pre-existing diseases, surgeries, and life habits. For this appointment, the parties must bring preoperative exams, the procedure's guide and specialist medical reports, when necessary. The anesthesiologist will perform a physical exam to verify vital signals, evaluate airways, which is mouth opening and neck mobility. Evaluate conditions that can contribute to decision-making of the anesthetic technique. Informations about the anesthetic planning will be provided, explaining the technique proposed in analgesia plan, as well as the risks and complications potentially involved. It must be noted that the professional that makes the appointments may not be the one performing your anesthesia on the day of the procedure. You will be oriented about preoperative fasting, continuation or discontinuation of medications, and other needs for your surgery as an ICU reservation, blood reservation, additional exams. In cases of inaptitude to make the procedure, the patient will receive explanations about the reasons, and orientations on the next steps to take. At the end of the appointment, the anesthesiologist will ask you if all the information given was understood by the patient and the family member. Informed const form. After consultation, the anesthesiologist will present a document which registers this act, so the patient or guardian can read, date, and sign agreeing, if applicable, with what was proposed. Risks, complications, benefits, and alternatives will be discussed. These risks vary and depend on the procedure, the anesthetic technique, and the patient's health condition. Types of anesthesia. The choice of anesthesia type is made according to the surgery proposed, and its location, as well as health conditions, and when possible, patient's preference. In children and people with special needs, the anesthesiologist will discuss the best way to conduct them to the surgery room, and about the better method of induction. After the procedure, the guardian will be asked to the post-anesthetic PACU, where they can participate in the recovery moment. Throughout the whole procedure, the patient will be monitored: heart rate and rhythm, blood pressure, temperature, oximetry, pain evaluation, as well as other monitors that can be used to promote patient safety. Regardless of the chosen technique, the anesthesiologist will be beside the patient during the whole procedure. At the end of the procedure, the patient will be referred to the PACU, where he or she will remain for a period of 30 to 60 minutes under monitoring and care. After this period, the patient will be transferred to the room. In specific conditions, at the end of surgery, patients will be conducted to ICUs. There are a few types of anesthesia, which will be presented next. Sedation. It is a state of partial or total unconsciousness for the purpose of providing comfort and reducing the anxiety for the procedure. It can be induced with venous, oral, intramuscular, or intranasal medications. The sedation can be used as an isolated technique, for example, endoscopy, or associated with local or regional anesthetic techniques. General anesthesia. This technique allows a state of loss of consciousness, similar to a deep sleep, in which the patient will not feel pain, will have full unconsciousness and muscle relaxation. It can be performed for every type of surgery. There is a control of vital signals and respiration by the anesthesiologist that will choose the best alternative, either with the use of a face mask, laryngeal mask, or through tracheal intubation, to ensure this control. The general anesthesia can be administered by inhalation, venous or balanced, which is a combination of both these techniques. At the end of the procedure, the anesthesia is interrupted, the airway device is removed, and the patient breathes normally. In instants they wake up. Spinal blocks. Some surgeries can be performed through spinal or epidural anesthesia, which consists in the injection of medication under the spine. With these techniques, the nerves remain anesthetized for a period, preventing from feeling pain and movement of the legs. For greater comfort, they are usually associated with sedation or general anesthesia. Also, these techniques can work as a treatment for postoperative pain. Peripheral blocks. The anesthetic is applied next to a nerve, usually with ultrasound assistance. Other procedures. In some cases, other invasive procedures will be necessary for anesthesia and monitoring during surgery, such as central venous access, arterial puncture for invasive pressure measurement, and gastric tube. Postoperative analgesia. All patients submitted to a procedure they might feel pain are treated to minimize this symptom. In the pre-anesthetic appointment, they will receive orientations about therapeutic options and how to report their pain through a scale. In high pain potential surgeries, the CVM will offer the SIDAPO, postoperative acute pain services in the postoperative. What is SIDAPO? It is a service that enables follow-up with specific methods for good pain control, for a period of 24 to 72 hours, and daily visits. This service is activated after the surgeon's request. Among the techniques used in the postoperative period, we can mention patient-controlled analgesia. An analgesic solution will be administered to the patient through a venous or epidural catheter. The device consists of a programmed infusion pump, with the solution to be administered continuously, or when the patient finds it necessary for additional doses through a trigger. The mechanism is explained by the anesthesiologist in the pre-anesthetic consultation, and in the patient's room. Continuous epidural analgesia consists of the continuous administration of analgesic solution via an epidural catheter. Continuous venous analgesia, which is the continuous venous infusion of medication and peripheral blocks. Remember, you can also ask your surgeon about this possibility. To ensure patient safety during anesthesia, it is necessary to correctly follow the fasting guidelines. Preoperative fasting is important to reduce the risk of vomiting during anesthesia, which can cause serious complications such as aspiration pneumonia. For adults, we recommend fasting from all foods for 8 hours. We suggest the ingestion of clear liquids such as water, light tea, coconut water, and isotonic drinks. You can take 200 milliliters every 2 hours. But beware! With 3 hours left until the scheduled time, you cannot ingest anything, not even water. For children over 6 months old, the recommended fasting is 8 hours for food. She may take clear liquids fractionally 10 milliliters per kilogram every 2 hours, up to 3 hours before the procedure. For example, an 8 kilograms child may take 80 milliliters of clear liquids every 2 hours during the 8-hour fasting period, but must suspend all consumption 3 hours before the scheduled time. In breastfed or exclusively breastfed infants, fasting will be only 4 hours before the procedure. Avoid prolonged fasting. Medications. In general, oral medications should be maintained until the day of surgery. If you are already fasting, you can ingest them with a small amount of water. The patient will be instructed at the pre-anesthetic consultation regarding the use of oral antidiabetic agents and insulin. Some medications that interfere with blood clotting will probably be discontinued, according to each case. Any suspension of medication should be discussed by your anesthesiologist or attending physician. Do not stop any medication on your own. Before the procedure. The day before surgery, the patient will be contacted by phone confirming the admission time. Remember to confirm the expected time for the procedure. Respect the fasting intervals. Avoid high-fat foods on the eve and day of surgery. Avoid drinking alcohol for 48 hours before the procedure. Remove your jewelry, makeup, nail polish, fake nails, contact lenses, artificial eyelashes, piercings, and synthetic hair extensions. Glasses and mobile dentures can be brought to the hospital, but they will need to be removed before your procedure. If you have respiratory symptoms, diarrhea, vomiting, or fever 100.04 degrees Fahrenheit in the days leading up to surgery, notify your surgeon immediately. If you decide to cancel your procedure for any reason, inform your surgeon and the hospital. On the day of your procedure, go to the hospital at the established time, carrying your documents, preoperative exams, and consent forms. Follow all the recommendations given to you in the pre-anesthetic consultation in addition to the specific recommendations of the hospital and your attending physician. In the operating room, the anesthesiologist will introduce themselves to the patient or their family, confirm some information, and discuss the proposed technique with the patient. After the necessary confirmations are made, basic monitoring will be performed, including blood pressure, pulse oximetry, temperature, and heart rate. Next, the anesthesiologist will insert an intravenous access for medication injection and begin the anesthesia procedure. For children, the confirmations will be made in the presence of a family member or guardian, and the anesthesia approach may be different, but always ensuring all necessary safety precautions. Post-anesthetic indications. After the anesthesia, you should follow the attending physician's instructions and only get up from the bed when your vital signs are stable and you are fully awake. Food will be allowed as permitted by the attending physician. If you experience pain, nausea, or vomiting, contact the nursing service, and if necessary, the anesthesia service. During the 12 to 24 hours after the procedure, avoid activities that involve concentration or compromise your physical integrity, such as driving, making important decisions, handling machines, or sharp objects. In some cases, you may be discharged with an arm or leg still under the effect of motor and sensory blockade. Please take care and avoid walking barefoot, handling hot or pointed objects as you may injure yourself without realizing it. In some situations after spinal anesthesia, the patient may experience headaches with specific characteristics. If this happens, the patient should return to the hospital or contact the CVM anesthesia service. For same-day discharge procedures, it is essential to have a companion over 18 years of age. The Valder Medrado Anesthesia Clinic is available for any necessary clarifications.